Identifying sources of technical risk, and I lump clinical risk into that as well, because it's hard to separate the two in our field. A lot of it is engineering analysis. Your design, the failure points. We've got better and better analytical tools. All of the finite element and physical modeling that we can do. Your prototyping and breaking of the device, you're going to identify those. You can't identify all of the potential failures up front, which is why as you go through the development, you need to keep updating your failure analysis. It really comes down to the engineering intuition and the engineering analysis on the technical side of things, and then being close to your clinicians on the clinical and procedural side of things, just really brainstorming out everything that can go wrong. There are technical failures that can happen during the procedure, and you need to be thinking about what your bailouts are going to be if something breaks when it's in use. How do we get ourselves out of trouble there? What's the bailout for the patient, the physician, and the device? Knowing whether to and when to bring up a potential risk in the analysis. It's probably never a good idea to sit on it if it's a thought. That's where, in a lot of this, you have to trust your teammates, and you have to get over the human nature of not wanting to look stupid in front of people, because you look a whole lot dumber if you don't bring up that risk and then it occurs. People are going to get hurt. So it's best to bring up any concern, potential risk, potential failure as soon as you start to think about it, and then work together to figure out what's the best way to figure out if it's real or not.